Hi, this is Manar from Manar Incorporated Critical Care Technologists. I'm going to make a 2-minute video for you about midlines, what it is, when to use it and when not to use it. What it is a medium length peripheral catheter. So we insert it into the upper arm. It's about 8 to 12 centimeters long in adults, and pediatric patients we insert smaller ones, about 4 centimeters. This line is inserted with a sterile technique. It looks like this, and also with full ultrasound guidance. Okay, so this is how it looks. This line is either secured with a stat lock, or sometimes we do use sutures to secure the line. This line is ideal for patients that want to use their arms, and patients like pediatric patients that have to use their arms, or patients that need some physiotherapy and need to use their arms for that. What this is not a central line. You cannot give any medication that you need to give through a central line or a PIC line through a midline. So your chemotherapy, your TPN, your vesicants, your high concentration drugs, you cannot give that through a midline, unfortunately. What it is, it's an ideal line for a DIVA patient, a difficult IV access patient. So that's the patient that's been poked about 3 times, you don't get any line up, and now you revert to a midline. You ask the vascular access team to come and insert a midline for this patient. Also, patients that the line pulls out every now and then, or the line would tissue or extravasate every now and then, a midline is the ideal line, as it can stay in for about 28 days. It's also ideal line just for fluid therapy, for pain medication and normal antibiotics. This is also ideal for patients that is very scared, because they're only going to be pricked once. So we do not need any anesthetic. We do give them some local anesthetic. So bottom line is, this is a good option for a patient that needs an IV line that is patent for a longer period of time, or a patient that has got difficult IV access and you need reliable IV access in a patient. We do insert these lines for anesthetic purposes as well, especially patients with longer anesthesia or patients that must be moved during anesthesia, so that we know that these lines doesn't pull out. If you have any questions, you can send me a message, or you can just visit our Facebook page.